Okay, awesome. So, hi everybody. Welcome to tonight's webinar. Tonight we're going to be talking about unlocking your body's natural defense by discovering homeopathy. So tonight we have our homeopath, Chaitali Shah. If you haven't met her yet, she's amazing. She's been with us now for quite some time. And I'm going to let her take it away. If you have any questions or anything, feel free to put it in the chat. I'll be monitoring that stuff. And if we have time at the end, we'll answer anything you can. But if we don't get to it, we'll be happy to reach out to you individually because we're going to send out a recording for anything you miss. So sit back, relax, and enjoy. And Chaitali, I'll let you take it away.
Thank you, Kiran. Thank you, everyone, for joining us tonight. I'm Chaitali. I'm the homeopathic practitioner at Bosna Health. And, I'm just here to kind of give you guys a little bit of lowdown about really what is homeopathy and how it kind of works. It's a very basic, more like an educational kind of a, session, just so you can understand in what situations you can make use of homeopathy, like in what situations it can be beneficial to you or, your loved ones. So I'm going to share my screen and just kind of go through some slides. Feel free to, like Kier said, post your questions in the chat, or we can have a questions session at the end of the webinar. Whatever works for you. I'm happy to do that. So I'm just going to share my screen now. Okay, got it. Oops. All right. So this is just a little bit about me. So I got my I have a bachelor's degree in homeopathic medicine, and I got the degree from India, and I've been practicing since 2011. So it's 12 years. But I was also kind of working with some doctors before that and all of that. So, I've been with patients since a good 13, 14 years. I'm in terms of like my licensing in Canada, I am licensed with the College of Homeopaths of Ontario, and I'm also registered with the Canadian Society of Homeopaths, which is in British Columbia. My special interest is in children's health, women's health, and chronic diseases. I've presented some papers and, some done a lot of these kind of educational webinars, done a lot of like health camps, screening, examination, screening camps and stuff like that. So yeah, that's about me. So just a little bit about homeopathy. Basically, it was a system that was discovered by a German medical doctor called Dr. Samuel Hahnemann. It was somewhere in the late 18th and the early 19th centuries. Basically, what he did was, he conducted a lot of experiments on himself, and he kind of realized that, even during his regular medical practice, what he observed was that every time there was an illness or like a physical condition, there was always a psychological component with it. So except for stuff like injuries or accidents where there's only an external factor, anything that happens to your body in terms of, say, you catch an infection, or you develop a chronic disease or like allergies or whatever, right? Like any kind of an illness, eventually always has a psychological factor. And with his practice, with his patients, the more and more he worked, the more he realized that treating only the physical aspect of a condition doesn't really resolve the condition. It doesn't really solve our problem. So a lot of times, like a lot of suppressants or palliative treatments are used, which is great in terms of the situations that cannot be resolved, but not everything is like that. So where we are at a stage, or where we are in a situation where we can actually help resolve it and possibly even reverse it, we must try to do that. And the only way to do that is in a more holistic way, rather than just focusing on, okay, like I have a headache, so let's take a drug that blocks the pain, the pain channels in the body, and then I will not feel the headache. But why did I really get the headache? Why is it that only I got the headache and the three other people who were with me in the exact same situation did not get it? So these are the kind of questions that kind of, troubled him and puzzled him. And, with time, he just noticed that there's a lot more to health and illness beyond just the physical part of it. So what he did was he started conducting experiments on himself, and one of his most famous experiments is the cinchona bark experiment. So cinchona is a tree. Basically, what from the bark of the cinchona tree, you get the what do you call it? Like the drug, the quinine. Quinine is basically it used to be a drug that was used to treat malaria at that point, and to an extent, even today, that still exists. Um, what Hahnemann did was he took like a good amount of quinine and consumed it himself, and he saw that first he started developing all the symptoms of malaria. Then he started reducing the amount of quinine that he was consuming. And there was a time where it was a really minute dose. And what he saw was that it evoked symptoms of malaria in him, but without the consequences of malaria, which is typically, in malaria, like there's anemia, there's jaundice and stuff like that. So, and then he conducted more and more experiments on himself with a lot of different kind of medicinal substances. And eventually that led him to his first theory, which is now called the first law of homeopathy, which is basically like cures like. So in his experiments, what he observed and what he concluded was that when a substance has the ability to invoke certain symptoms in the body, it can be used to treat the same kind of symptoms. So that's why it's called like cures like, or the law of similars. And to kind of explain it a little bit again, think of quinine. Quinine, the reason it is able to resolve malaria is because in a healthy person, if quinine is administered, it actually gives the symptoms of malaria. So that's what he observed again and again and again with multiple drug substances, and he kind of came to this conclusion. The second principle is the principle of a single remedy. So just like one remedy evokes a set of symptoms in a healthy person when it is consumed, so in the same way, when a person is ill, the entire person is ill, and it's not just the head that is hurting, or it's not just the pain, the abdomen. There is always a reason, and there's always multiple things. Like okay, so for example, if you have pain in the abdomen, you could also have nausea with it because it could be related to the liver. You could have like acid reflux because it could be related to your stomach or whatever. So there are always other symptoms, and then along with those physical symptoms, there are also some psychological symptoms, like the pain, for example. Everybody does not experience the same kind of pain. For somebody, the pain may be 3 on 10. For somebody, it may be a 9 on 10. So why this difference? Why why, for example, if, like, say I went out in the sun and I got a headache, but somebody else who was with me did not get that sun headache. So to think of the person as a whole and think of everything that is happening along with this particular condition, that is the totality. And there is always only one remedy that needs to be administered to take care of that whole situation, because it is always going to be related. So, for example, when a patient comes to me and says, okay, I'm here because, say, I have hyperacidity, but there will always be, like, I'll always take the time to understand, okay, you have hyperacidity, but how are your bowel movements? How's your sleep? How's your appetite? How is your stress level? How's your life going? Like emotionally, how are you doing? How's your mental health? Because, and again, we all know that stress is always the cause for everything. So stress is a very, very, like a very big umbrella, but there are so many things that could lead to stress. It could be physical stress, emotional stress, there are so many different things. So if somebody develops chronic acidity, for example, there will always be some amount of stress. Now, that stress could be a lot of things, but it is important if you want to really heal the person in a holistic manner, it is important to know about that and to kind of address that. Of course, there are many ways to address it also, like therapy and all of that. But as far as homeopathy is concerned, I need to know that to understand what is the correct remedy, because each remedy has its own potential to work on different spheres of the body. So the affinity could be to, say, the stomach, or to the joints, or to your um, like your glands, or the endocrine system, which basically is directly affected by your stress levels, or your emotional imbalances and stuff like that. So it's very important to really know the root cause of anything, even though it may seem like a very trivial or a very irrelevant things. Most of the times they're always connected. So that's the principle of a single remedy. The third principle is the principle of minimum dose, which basically what it means is that when a substance can evoke some symptoms in a healthy body, the same substance, when you administer it in like super diluted, potentized doses, can actually cure or resolve those symptoms. Quinine was one big example, but there are lots of such examples. In fact, in modern medicine, like even some allergy treatments are that way, in which they kind of introduce a small amount of the allergen in the body. I don't know if anybody has ever heard of it, but you actually get dust tablets that are used for allergy treatment, and it's because people are allergic to dust, and these dust is kind of introduced in the body, so your immune system recognizes it and learns to build an army against it, and that's how it will keep fighting that dust. So of course, but that's a whole different topic, and it kind of goes in a very different direction, because when you're consuming that much dust, you're also constantly triggering the immune system. But basically that is just to kind of simply understand it. But where homeopathy is concerned, the substance is super diluted. So when you dilute it to that extent, where it is just enough to stimulate your immune system and not really trigger it. So like your immune system needs to recognize things as friends and enemies. And if you give too much of the enemy, your immune system is going to be like, okay, there's more, and they're going to be hyperactive. Like they're going to, keep producing the T cells and stuff like that to kind of fight those enemies. But if you give a very slight amount, it will be stimulated enough to recognize that this is an enemy, and it will build its own like it will not go into a frenzy and become hyperactive. It will stay at a at like it'll work in within its physiological parameters, and be ready to fight that if that amount of the allergen becomes too much, like if you're exposed to it too much. And that's exactly how homeopathic remedies work too. It gives the immune system just enough trigger, um, not trigger, but stimulation, to learn what it needs to work on and fix it. Like, our bodies have that innate healing power. Um, and it needs to be tapped at the right time, and in the right way, so that the body itself can heal it. Homeopathic remedies they don't really heal or cure the person. They basically, um, you know, provide a support system to your own healing properties, like your own healing power, to heal the body, like to heal yourself, if that makes sense. So, and then to talk about the immune system. So, we kind of touched based on this in the previous conversation, where basically there are two types of responses of an immune system. It's either, like when you're trying to treat something, the body is going to have, like, there are two approaches. So either directly the symptoms are going to be targeted, or your own healing power can be stimulated, where your body can actually work on healing itself. So, for example, like, in the European Journal of Pharmacology, there was a study done on a homeopathic remedy called silica, which is basically made from glass. Like, it's silica, which is sand or glass. And what was shown was that when a very small amount, like a homeopathic dosage, was administered, it triggered the body's immune cells, which engulfed the bacteria and the foreign substances. So, again, it's just about enough. And silica is really, like, it's a very, very popular remedy in homeopathy when it comes to infections, and stuff like that, like pustular infections, or like even acne, but like the pustular acne and stuff like that. Because, again, at the end of the day, if there's infection there, silica is going to trigger your immune system to fight it, because clearly it couldn't fight all this while, which is why it's developing. So, so basically there are two types of approaches. Like, people say that homeopathy may be an immunostimulator or a modulator, but I feel like it's more of a modulator than a stimulator, because it's not necessarily stimulating. So, for example, in autoimmune disorders like, say, psoriasis or rheumatoid arthritis, um, when the correct homeopathic remedy is given and in the right dosage, it can actually even calm your immune system. Because basically an autoimmune disorder is what? It's just your immune system working like beyond its capacity. It's working where it's not supposed to be working. It's recognizing everything that is a friend also as an enemy, and it's kind of trying to fight everything, which we don't want. So, but that's basically what an autoimmune disorder is. And there's no cause, there's no reason for why the body suddenly switches gear and decides, okay, from today, this is a enemy and I'm going to try and fight it. This leads to a lot of inflammation and stuff like that in the body. But when it comes to trying to treat those, the most common approach is immunosuppressants, because your immune system is super active, you suppress it. But again, that's not resolving the problem. What we actually need is to modulate the immune system, is to calm it down, to kind of, turn it back to what it was when it was functioning normally. So that's another way of looking at how homeopathy can work with your immune system, and not really against it in the sense of suppressing it, or even against it in the sense of overstimulating it. But the most important thing over here to know is the correct remedy. So this is, again, going back to the totality that we spoke about. Like, homeopathy is not one size fits all, because say there are three people who say are under the weather right now, whatever, it's the weather's changing and all of that, right? But somebody may develop pain in throat and tonsillitis, while another person may develop a sinusitis, like the sinuses may get filled and they might have a blocked nose and fever with that. And then there might be a third person who will just have a trigger with the allergies. So really, the cause is the same, but everybody is responding differently. So you may even if even if there are three people with allergies, for example, like say the diagnosis, the name of the condition is the same, even then the symptoms might be different. Somebody might have watery eyes. Somebody might have a runny nose. Somebody might have an allergy on the skin, but nothing in, nothing in the mucous membranes or whatever. So again, the diagnosis is okay, it's a seasonal allergy. The regular medical approach is it's an allergy. There is extra histamine in the body. So you give an antihistamine and suppress the histamine. But really, why did these people respond like that? And why do they respond differently and individually? So that's where, that individualization of homeopathy comes in, where the entire picture is taken into consideration. Whether there are any other physical symptoms, whether there was any other cause. The change in weather is, yes, one thing, but our bodies are made in a way that we should be able to take these changes. So why is it that this person reacted? Why is it that their immune system or their temperature system in the body was not able to kind of, like auto-tune, like sync with this change? So again, there'll be so many other things that we speak about. And accordingly, the correct remedy is chosen. So for the three different people that I gave examples of, even though the diagnosis is the same, the remedy is going to be different for each of them, because they are all very, very different from each other. And the situation is very much different from each other. So in another study with rheumatoid arthritis patients, for example, when the individualized choice of homeopathic medicine was given, and by this, I don't mean one medicine was given to all of them. I mean like different medicines were given to each of them, depending on their situation. 82% of those experienced relief of pain, while only 21% of those who were given a placebo got a similar degree of relief. Because a lot of times, I hear this that, okay, homeopathy is just a lot of placebo effect. You, as homeopaths, we talk a lot with the patients, and we take like 1.5, sometimes even 2 hours talking. And a lot of people claim that, oh, it's just talking, and it's just that catharsis and that kind of therapeutic effect, that it doesn't matter what you put in the medicines, it's that works. But no, homeopathy works for animals where we have no communication. It works on plants. There's a lot of study and a lot of actually practice going on where a lot of homeopathic remedies are used for agriculture, because more and more and more species of living organisms are becoming, are becoming intolerant of antibiotics. Like they're becoming resistant. And at a point, where is that going to go? So people are looking for other choices. And there's a lot going on in terms of homeopathy, whether it's plants, animals, not just humans. So definitely not a placebo effect. And, there are a lot of studies for people to see. And then, yeah, the immunostimulating and immunomodulating part, which we have been talking about. Basically, it modulates the immune system, regulates it to a point which is healthy for your body. And that's how the individualized remedy is going to help, and not like one size fits all, because that's not going to help. So typically in like a homeopathic consultation, so like I was saying, right, so the first thing we'll talk about is like, okay, why are you here to see me? What is the thing that is actually troubling you, which most often than not is always a physical complaint. Along with that, okay, is there any other physical complaint? Now, a lot of times patients feel like, yeah, no, but it's not relevant. Why are you asking me about this? Why are you asking me about that? But you may not know, but it may be relevant. For example, you might be getting migraines, and you may come to me with that. And then you have discovered 3 years ago that you have high liver enzymes. And if you don't tell me that, because you think that the head and the liver are not connected, I may not be able to help you, because high liver enzymes can lead to headaches. Taking medication for something can lead to headaches, or it's just an example. But like, it's important to to share all the physical issues, even though you may not be seeking help with something, because it may be important to me as a homeopath, because like I said, a lot of things are connected. And not just from the homeopathic point of view, but generally, like medically, physiologically, anatomically, things are always related. So it's important to know all of that. So we go into great details of all of these things. Past history, medical history, family history, very, very important. General lifestyle and patterns and habits. Again, I cannot emphasize enough on how these can affect our health. And, like somebody may look fit and healthy, but if that person's not sleeping well, for example, they're not healthy. So things need to be addressed. Sometimes a lot of physical conditions are just because of a lifestyle change, or they stem from a mental health issue, which eventually manifests as a physical condition. And then, of course, there's physical examination that I always like to do with, like, especially if I'm seeing the patient in person, which is always preferred. Um, Physical examination is always important, because what the patient's telling me are the symptoms. But then, as a health practitioner, there are also signs that I will pick up on, and then examining the patient obviously helps with that. And all of this helps to identify that correct homeopathic remedy, that one thing that is the exact match to the situation. So, which is why, these details are important. And then what really happens, like, okay, say we've done the first whole session, and I've kind of figured out, okay, like this is what I'm feeling. This is the remedy I want to give, and I've given it. What are the things you want to typically expect after taking a homeopathic remedy? So there are three possible outcomes, most likely. First is recovery. Second is an initial aggravation. And then the third is a remedy reaction. So the recovery is our most favorable response, because what happens in this is the patient starts gradually, like slowly but surely, starts feeling better. Mostly the feeling of like feeling better starts at a more general level. Like, say if the appetite was bad, that starts getting better. The patient starts feeling hungry, the sleep pattern gets better, the bowel movements start getting better. Like, that is the more general well-being. We start seeing some changes in this initially more often than not. And then, of course, it'll be followed by the specific symptoms that they were talking about. But this is a gradual process. And then also one way of, thinking about whether it's actually helping, or, whether you're actually like things are getting resolved, is symptoms will always disappear in the reverse order of their appearance. So they disappear in the reverse order of their appearance. So, for example, say you have eczemas, and the first eczema patch came up on your left forearm, then you had something on your abdomen, then you had something on your right shin, and then you had something. Okay, let's end at the right shin. So when we're trying to treat that, if we have the correct dosage, the correct remedy, your body will respond. And what you're going to see is the thing that came up last will go first. So your right shin is going to start getting better sooner. And then that's going to be followed by the abdomen patch. And then the last will be your left forearm, which had appeared the first. So this is something important to just generally also keep in mind. Homeopathy, no homeopathy, doesn't matter. This is how your body responds to anything. This will always be the order of disappearance of symptoms if it's going in the correct direction. And then, it's always also from inside outwards, or from the more important organs to the less important organs. So, for example, if you have eczemas and if you have hyperacidity, your hyperacidity will resolve first and then your eczema, because your stomach, your intestines, or esophagus, they are more important organs than your skin to, kind of to keep you alive. So this is our most favorable response after a homeopathic remedy. The other response could also be an initial aggravation. Now, this is because, like we learned from Hahnemann's experience earlier, that if the dosage is too high, it will actually evoke the symptoms in the body. So if the dosage was a little bit higher, what will happen is the symptoms that were already there, they will actually be heightened a little bit. So that's where, that's why we call it the initial aggravation. But in this kind of a situation, it's very important to bring it to the attention to your homeopath, because one, it's a positive feedback, because then I will know that, okay, it's the right remedy. I just need to lower the dose. I just need to taper the dose and kind of, tune it to the frequency of your body. But again, it's a favorable response, but not exactly pleasant for like, for like the first couple of days, maybe, because that's when we initially see this kind of an aggravation. But again, it's very easily modulated. Just a little bit tweak in the dosage, and within a couple of hours, things should settle down. And the third one is, of course, the remedy reaction, which is not what we want. It's because either the remedy given, was not the right one, or the dosage was too high or too low, and you're either not going to have any effect, or you're going to have like an unfavorable effect, and it's not recommended, of course. So again, very important to let your homeopath know. And instantly there are antidotes. Again, and like, okay, I'm using the word antidote and stuff, but it's nothing to, like, it's not scary, it's not anything. It's just that you will know that this is not a favorable response. And if you bring it to the attention of your practitioner, they can kind of help you through that. But again, these are the three responses that we see most often. The first two are very, very, very much more common than the last one. But again, it's the doses are so minute that it cannot have a really adverse effect on the body. So yeah, so this is pretty much a very basic understanding of, what homeopathy is and how it works, and how it can help you. So based on these, there might be some, if you guys have any questions, or there might be some situations that you're thinking about and wondering if, if it can help through that. So I'm here, we can talk.
Hi, everybody. I'll give you guys a chance to ask any questions in the chat, or if you want to raise your hand, I'm happy to give you or facilitate anything you need. Give you guys a couple minutes just to see if anyone raises their hand. Okay. Well, it doesn't look like we have any questions. Is there anything you wanted to add, Chaitali, before we say goodbye and sign off for the evening?
No, I try to stick to like really basic understanding of homeopathy. But of course, people might have like, different things. So feel free to like email us or whatever. If something comes up later, I'm happy to answer your questions. I'm happy to share any kind of information if that is required. Yeah. Yeah.
Awesome.
That's it.
Okay, great. Have a great night, everybody. And thank you so much for joining our webinar. And, give us a call at 416-487-9056 if you have any more questions, or you want to chat with Fatima about booking homeopathy. Awesome. Have a great night, everybody.
Okay. Bye, guys. Good night.